Hi, I'm Simone Hepburn from Simone Hepburn Health. I've been a registered physiotherapist for more than 20 years, and today I'm doing a product review of the Hanes non-slip socks. Should we be encouraging all our patients to wear these non-slip socks temporarily during their inpatient stays as a way of falls prevention? So we're going to take a look at three things. Firstly, we're going to take a look at the literature. What does it say? Then we're going to go to clinical practice and see what's happening. And finally, I'll give you my opinion. The best find was a literature review about the effectiveness of non-slip socks. And I love a good literature review because it does all the hard work for you. So this one is from the Geriatric Nursing Journal by Canadian researchers in 2017, so quite recent. It said that the evidence for non-slip socks was inconclusive at present, which is not surprising because the causes of falls are multifactorial. They went back over 20 years and they only found 6 high-quality studies worldwide about non-slip socks, the first one going back as far as 2006. So there just wasn't enough of them to prove effectiveness. Some of those 6 studies looked at the whole falls prevention program, so they couldn't isolate which factor was being effective. Some of the recommendations from literature review were that the safest option is always for the patient to wear their own footwear from home, which is great, but what happens if they didn't bring it or we deem their own footwear to be unsafe, unsuitable? They also point out that non-slip socks have a risk of spreading infection. But I say don't shoes and barefoot also have a risk of spreading infection. The last thing they said was that socks don't possess the same qualities as shoes, which I definitely agree with because they're socks and they don't have support in them like shoes. So the literature review provides us with some answers and some direction, but let's hear from some of my colleagues and find out what happens in clinical practice. Okay, Emma, when you go into different inpatient facilities, what do you see with respect to footwear or barefoot or socks?
When generally going into hospital settings to complete assessments for people that are over the age of 65. So what you'll see very commonly is no footwear, other people's footwear.
Really? Other people's, they're wearing other people's?
Yeah, because often they've come in a traumatic event. They haven't had time to pack their own bag. They may have a degree of cognitive impairment, so they might not identify their own shoes as being their shoes.
Oh.
Just they'll grab someone else's. They might walk around in their TED stockings or their slippery tights, whatever they've got on. So just an array of different things that are probably all inappropriate.
And what do you think about the non-slip socks then?
I think the non-slip socks, from what I've seen, are very good, practical, easy to get on and off. Obviously got the grip on the bottom. The only thing that I would within that age group is but I think they have a degree of stretchiness in them. So if somebody was unable to bend down, for example, they could still probably put that sock on a sock aid to just help them get that sock on. So from that point of view, it's fine.
I've showed you the socks earlier.
Yeah.
What do you think of them?
Yeah, I have seen those socks before. I felt them. They're very soft. They're quite stretchy at the top. They've got a great grip on the bottom. I think it's really important for this age group too, that they are quite stretchy and easy to put on and off. A lot of people in this age bracket have trouble getting socks on and off. And then we can prescribe a sock aid. That sock will actually stretch quite easily over the top of the sock aid, and then they just put it down. It's just easier for them to get on. So that's a really good point with the socks.
Good. So a place for them then, rather than a slippery TED stocking.
Yes, we don't like the slippery TEDs.
So we know that falls prevention has many factors involved. How important do you think that the choice is?
Footwear choice is very important, especially in hospital setting. One of the major factors for people in hospital is not wearing footwear appropriately, slipping over, falling, breaking a bone. It can be catastrophic. So it's really important to get them at that point in time, get them in the appropriate footwear. They're probably not going to bring their own footwear in. So to have something like this product is just easy, get it on, stop those falls.
Okay, so you guys have been to 6 hospitals between the two of you with your physio student placements. And can you tell me a little bit about what you've seen in clinical practice between socks, barefoot and shoes?
Yeah, so the first one I had was a cardio rest placement, and this one was pretty strict on having these no-slip socks. And then they could also have their shoes, but it either had to be one of the two. The next placement was ortho, and this one was a little bit more dependent on the educator. They had the opportunity to wear socks if they would like, but they could also be barefoot or shoes. And the last one I was acute stroke, and this was kind of more preference to the patient, but you also had to be careful that with these stroke patients, it didn't grip too much if they couldn't clear their foot during the walk.
So my difference in settings, in ICU, these were mandatory, so your non-slip socks you had to wear at all times. Then you go out to heart failure, where the patients have been there for quite a while and they didn't have to wear them. They could if they wanted to, or they could wear barefoot or just their shoes. And then my other setting was in orthopedics, which again was more so patient preference.
Talking with my physiotherapy and occupational therapy colleagues and students, it makes sense that clinical practices vary, right? Preferences vary depending on the patient profiles that you're seeing. Some hospitals are mandating non-slip socks, others are leaving it to patient preference, and others are specifically prescribing them on a case-by-case basis. So overall, in my opinion, I like them. I'd recommend them, particularly for cases where the patient hasn't brought their own shoes or can't find their own shoes, or their shoes are inadequate or unsafe. Also remember that if the patient is used to wearing no shoes, and yes, that does happen in some Northern Australian climates where it's too warm to wear shoes at all, then they should stay no shoes. Things that I like are the quality, the comfort, the breathability. I like the feeling of grip on the bottom, and also that they're not too tight around the ankle for any swelling. They shouldn't act as a tourniquet there. I requested to sample the 3 sizes, which is medium, large and extra large, and I just fit into the medium. I'm a 8.5 women's. I found them a little bit too big. So I spoke to Haynes, and I know Haynes are always open to customer feedback, which I give a lot of feedback. And they assured me that there were some more sizes coming in the future, some smaller and some larger. So there it is. Use your common sense. Keep safe, keep your clients safe. If you'd also like to sample some non-slip socks, just contact Haynes through their website and just request a sample there.